Dr. Beck, tell me, physical therapy and chiropractic, which one should I go? Don't you guys do the same? What's the deal? Shed some light on it.
Okay. Well, there's a lot of confusion sometimes about physical therapy and chiropractic, mainly because many chiropractic physicians also have physical therapy in their offices. So you can get both chiropractic and physical therapy at a chiropractor's office. And obviously, I don't do chiropractic because I'm not a chiropractic physician. I think the main difference between physical therapy and chiropractic is that chiropractic is based on a different philosophical system of understanding of why people have pain. And this is based on alignment of the spine and things like that. And so their treatment typically is focused more on adjustments of the spinal column, things of that nature, rather than therapeutic exercises, which what we really focus on with physical therapy. For example, if you have a sports injury and you go to a sports physical therapist, they're going to work with exercise because exercise is the only way to get you back to doing a sport. And so frequently people will be a little bit confused. You can do both. But again, it's really a different philosophical system that they're operating under versus a physical therapist. So I would say that the physical therapist is going to be much more tuned into therapeutic exercise versus adjustment. Although, again, there is a little bit of crossover between the two. Some therapists do adjustment. Some chiropractors do physical therapy, which is not bad. But, again, we are really focusing on this as a therapeutic exercise being the key to remedying a lot of the problems that I see.
Interesting. So what it looks like to me, what you're saying is more like a chiropractor does things to you because he goes and adjusts you, and a physical therapist makes you doing things, meaning by you, meaning the patient, makes you going into action and into motion. So in physical therapy, the patient plays a little bit more an active role in getting healthy than with the chiropractor.
Yeah, I think that's a great way of looking at it. And in fact, if a physical therapist isn't making you do things and is doing it all to you, you're probably not in the right place. You have to take the tools and use them yourself if you're going to get better, from my perspective.
Well, there have been many great wise men out there from all aspects of life, be it making money, being happy and married. You know what it is? They say, don't fool yourself that you actually can help a person. You can't. However, you can help and coax and guide a person to help himself, and that's as far as you will go. In the end, we need to help ourselves. It wouldn't matter how much Harvard school you go to and 25 other ones. In the end, you've got to be out there making the money, making the new invention, doing what you have to do. It's not the school. It's not your certificate which will ever do it. Is that a kind of a similar analogy?
Yeah, that is my philosophy. Ultimately, you have to take the ball and run with it. I can't make you do it. As they say, you can bring a horse to water, but you can't make him drink. And so if you're unwilling to participate and actively take charge of your recovery, then you're not going to get better.
Okay. Well, powerful information, and definitely I'm sure for some people can avoid that threatened knife. And if you still need it, at least you go in more fit. And I guess that should have some advantage also.
And the other thing, you've tried everything conservatively before you go to the more invasive type procedure. So you've given everything a shot. And then if you're ready for surgery, you're ready for surgery.
Got it. Thanks a lot, Dr. Beck.
Thank you.